What's up, everybody? It's me, San Martin, and I have a special guest today. And what we're going to do is talk to you and educate you about some things. But first, you got to check out this. Oh my gosh. Okay, so I really love doing these vlogcasts. And the reason why is because we get to find out about a lot of great people in our community. And this one is somebody that you definitely need to meet. And the reason why is not only is she amazing, but she's also good in spirit. And she really does have like that vibrant feel. And that's the reason why we're working with her. That's the reason why we're going to go ahead and pump her up. But at the same time, we want to make sure that you guys know what she does. And without further ado, tell everybody who you are and what makes you famous.
Good morning, everybody. I'm Dr. Kimberly Albarran. I'm a physical therapist and a certified functional nutrition practitioner.
Oh, and tell everybody kind of what that means, because I mean, let's just face it. When you guys see the headline, it actually shows all of the additional letters on the end of that. But that takes some time and education. And tell everybody a little bit about that.
Yes, so I've been a physical therapist for 9 years. I graduated from Northern Arizona University with a clinical doctoral degree in physical therapy. And along the way, I really started to be interested more in working with individuals that have chronic pain and taking a holistic approach. And nutrition is something we touched on in school, but we didn't get a lot of education about it. And so when I was speaking with my patients in the clinic, I was asking them what they were eating, and they were asking me why they had chronic pain. And so there wasn't really a lot of education about nutrition, even with patients in their physician's offices. And so they really don't know how what they're eating influences their body. So I decided to become a certified health and wellness coach, and it just took off from there. And I finished a 10-week online course on functional nutrition related to chronic pain and learning about how food can be inflammatory or anti-inflammatory and be part of the treatment that we put forth in helping someone heal from chronic pain.
Okay, so when you came to me, it was more of a kind of like a moment where it was like an educational moment for me, because when people actually get into the point of like pain from either working or pulling something or sports injury or whatever it may be, we were easily directed towards, here's a pain medication, here's just cover it and let's mask it until it like heals itself. And you came to me and we're like, man, there's ways to go ahead and actually heal this without actually trying to cover it up, because potentially you're going to be like just covering up something, masking it up, and eventually it's going to be re-injured or something. But when you talk to me about being able to go ahead and heal it with some natural abilities, tell everybody a little bit about why you went in that direction rather than saying, here's some painkillers.
Correct. Well, when your patients are at, a 12 out of 10 and they're taking, oxycodone and Vicodin and other medications, and their pain level's still extraordinary, it's not really doing anything to help the body. Now, if it's an acute injury and we sprain our ankle and we take an anti-inflammatory, then that's fine. But we don't want to be taking these medications for a prolonged period of time because, one, they metabolize through our liver or our kidney, which can then, limit our ability to process other toxins and waste from our body. And so that can build up in our tissues and in our fat cells and create more inflammation and pain. So we want to look at really what's going on in someone's life. And I do that through 4 pillars, and that's mindfulness, nutrition, sleep, and movement, because we want to make sure that all of those areas are in balance. And if one area is out of balance, then that's when we start to see pain and disease. So I went that route because I didn't feel that I was successful in the clinic, but I wanted to really have an impact on what I was doing with my clients personally and professionally, to spend more time with them, really educating them and really getting deep down into areas of their health that maybe no one else was really asking them about.
Wow. And it's kind of like, okay, I'm going to be a little bit honest with you. I've had like, this weird feeling towards doctors and hospitals and just anything that has to deal with them in general. I feel like when I if I go there, I'm going to be met with, you should try this. And I'm thinking to myself, like, what if I don't want to try that? I mean, I want options. I want the ability to go ahead and figure out what can I do in order for me to make my body better without even having to take any of those man-made drugs. And don't get me wrong, I am not a conspiracy theorist, and I might get in trouble for saying that. But at the same time, I feel like, to have a person that is willing to talk with you and share with you about uh, alternative ways to go ahead and heal yourself, I feel like that's a huge deal. And when you talk with your clients, I don't know if you call them patients, clients, whatever it may be, what is the first thing that you like to do with them? Do you like talk with them a little bit, try to figure out what's going on? And how does that
Definitely.
work?
So the first thing I really try to do is when I have like someone referred to me or they find out about me is we do a complimentary consultation because I want to find out what's going on with this individual's health. Why are they seeking out alternative care? Why did someone refer them to me? And really get to know them a little bit and make sure, one, that I'm the appropriate person for them because they may need to be referred out for either special testing or maybe to see a different type of provider than what I can do initially. But most of the time, it's really to find out what their goals are, who they are. And then we set up appointments. And on our first appointment, it's really we do a systems review. So I'm talking about asking questions, how you're doing that day, why you're coming to see me again, if I need to go into further detail. And then we really look at, what they're eating, how they're sleeping, what type of activities they're doing or not doing that might be increasing their pain. And then I'll do an assessment of, range of motion, strength testing, feeling their muscles, maybe doing joint testing. So it depends really what they need. If it's someone that has a lot of anxiety or they're very depressed and they cannot tolerate a lot of movement, it's just getting them on the table, helping them to relax, restore breathing is what I do with a lot of my clients first before I even have them exercise, and just really change the way that the nervous system is interpreting the internal and external environment. Because if someone can calm down their nervous system and get out of that anxious state, then they're going to be more able to focus and concentrate on what we're talking about and what we're doing, perform movements. And I say movement versus exercise because the word exercise can scare a lot of people. Like, oh my God, I went to physical therapy and they just hurt me. So it's really about just making the person comfortable where they're at and figuring out what they're able to do.
That is okay. So when you are actually discussing these conversations with people, obviously in your mind you're just like, dude, I know exactly what that takes. I know that exactly what that is in need of. Why did you choose this? Of all things that you could go ahead and like educate yourself with, why did you choose this?
It's such an interesting story. So when I was 10 years old, my grandfather had a stroke. And I've always been a pretty intuitive individual, like in tune with other people's emotions and feelings, like picking up things that like my aunt said, oh, what a cool profession. And at 10 years old, I was like, hey, this is a cool profession. I can help people. And I really saw how the physical therapists were taking care of my grandfather. And it was really something that was like just amazing over the years of watching him progress from being paralyzed on one side of his body to being able to walk with a walker to being able to walk with a cane. And so I always knew I wanted to be in a helping profession. And that's really who I am. I care a lot about people. I'm an empath. And so I believe that God put like, okay, the Kimberly, you're going to be a physical therapist. And, I love the ability to spend time with my patients, or I call them clients. I kind of use it interchangeably, but people will say, you're so smart. Why don't you become a physician? Well, I want to have that time to really sit down, get to know somebody, talk to them, find out what's going on in their life. And, over multiple sessions, I can really take my time and do that. And I'm not going to lie, there were times when I tried to do other things like personal training and adapted physical education, and those doors closed. So I really believe that this is God's purpose for me. in my life at this time.
That is so cool. And you know what? To have somebody like you in our community is a very big deal, because one of the things that I love is to be able to go ahead and conversate with, somebody that is like trying to help me as far as like physically or even like medically. And I'm just like, I just want to talk to a person, a human being that is not like, don't get me wrong, I'm not out here to attack anybody, but man, there are some doctors where you're just like, what in the world? Do they even care about my family? Do they? And that's hard to say, but at the same time, I feel like you would actually care. Now, how are you getting the word out to everybody? I know that you are doing actual classes. Can you tell somebody about that and yeah, and how they could go ahead and be a part of it? I'm going to put a little screen thing on here. Can you tell everybody what the master class is all about?
Yes, so the master class is called Chronic Pain, Moving You from Hurt to Healing, and it's based on my 4 pillars. We go into the introduction where we talk about we talk about pain and really how the body interprets a pain signal. And it's very interesting because we technically don't have pain receptors. They're called nociceptors that identify irritating changes in our tissue, our joints, our internal organs. And so we talk about how the body interprets that, what happens when that signal gets up to the brain, and how the brain interprets it, and the factors that might be influencing how it becomes chronic pain. And then we talk about mindfulness. We talk about nutrition in the way that, again, what's happening to our food supply and our food source? Why are we starting to see so many chronic diseases and chronic pain pop up from that? What types of food are beneficial in restoring our internal balance and helping to reduce inflammation? Then we talk about sleep, because a lot of people, when we're in pain, we don't sleep. We're waking up from pain, or maybe we have a lot of anxiety about pain. And so trying to figure out what can we do to create a good sleep hygiene pattern to get sleep so we can restore our bodies. And then we talk about movement, what type of movement is beneficial, and how do we pace activity so that we're not overdoing it and going back into that chronic pain cycle.
And you guys could go ahead and be a part of this. Is there like an actual capacity to these classes, and how does it work?
Well, right now I'm building my classes, so I haven't determined an actual capacity. My goal is for the master classes, as many people that would like to join, those are complimentary. There's no charge for those classes. I really want to help educate people in our community about how to be healthy. And so that does lead into my 5-week course series that is a paid class. And right now I've just finished my first class. I had 1 attendee, which, I mean, to me, I'm going to take whoever God puts in front of me, that's who I'm teaching, whether it's 1 person or 10 people. But I definitely want to build support and camaraderie within a group. And I want to make sure that the individuals who start together are finishing that class together so they can build rapport. So, anywhere from 10 to 15 individuals in that 5-week paid course, I think would be beneficial for people to pair up. But I don't really want to exclude or limit and put a number on it.
And speaking of number, we are putting the phone number that you could. Can you text, or do you wish to call or text?
You can do both. This will allow you to call or text in. If I don't answer, you'll receive a message with my calendar, so you can schedule a consultation call with me.
And if you guys don't know it, her business is technically called Hope, Health, and Healing. And you guys can find her on Facebook and also all the avenues. So you can go ahead and get her updates. And she has a group right now that she kind of like puts her inspirational stuff in. And you guys should definitely join it. I mean, if you guys are finding yourself in a position where you're just like, man, I'm getting older, I'm starting to feel some things, this could be the way that you could go ahead and get yourself back up to a working state of mind. We were actually talking about our ages this morning, and I told her, I said, I don't mean to ask you. She goes, no, you could ask me. And I was like, I don't know about you, but there's some people that say, do not ask a woman her age. But I did, and it wasn't because I wanted to know. It was just because I wanted to know, when and how what day and age you should go ahead and start taking care of yourself. I mean, you should start day 1, but at the same time, sometimes people get too late to the calls. So I think that any year of age is a good age to go ahead and get yourself into good physical therapy. Would you consider yourself a health coach?
Yes, definitely. I mean, I have a health coaching certification. So I'm not technically a life coach, but I go as a physical therapist. I'm not afraid to go to places that maybe other healthcare professionals are, being very sensitive to what the client is experiencing. Of course, we don't, if they've experienced trauma and things like that, I don't want them to live in their trauma and continue to relive it every time and talk about it. But yes, definitely looking at the emotional side, the spiritual side of things, and then looking at physical, including food. Why does someone eat too? Looking at, I have some people who are emotional eaters. Well, they're stressed out and now they're eating on top of it. So
I eat chocolate when I am feeling down. For some reason, it makes me feel happy.
It does. It activates the dopamine receptors.
I'm like, yeah, chocolate. And since it's Valentine's Day, we are really indulging in some chocolate. I ain't gonna lie, I'm gonna indulge in some chocolate. I like chocolate, but as besides the point, guys, we ain't talking about me. We're talking about her today. And what? Okay, so let's go ahead and end up closing it out. Tell everybody once again about the masterclass. I'll go ahead and put the image on the screen for everybody to see. And let me go ahead and get the beautiful name out of the way. Tell everybody once again about the masterclass.
Wonderful, thank you. So this is an hour masterclass on chronic pain and the 4 pillars, including mindfulness, nutrition, sleep, and movement. The next class is going to be on Tuesday, March 1st at Cornerstone Family Chiropractic in Prescott, Arizona, near Frontier Village. And the time is from 9 a.m. until 10:30 a.m. We have a 30 minutes for question and answer. So when we post in Facebook, we're going to go ahead and put a link there. You can register and be put into a group where you'll receive emails about the class and reminders about the class, and a personal message from me as well. So looking forward to seeing you attend the master class on March 1st.
And tell everybody how to get a hold of you. The best way to get a hold of you.
Yes, you can call 928-260-0881.
And if you guys didn't notice, it was been scrolling on the bottom, and this is the person that you want to see. If you're in need of some major things, major overhauls, I guess you would call it, and there's no age stopping or starting, you just need to get in there and start asking these questions. And I'm so happy that you're doing what you're doing, and we're going to find out more about you as time goes on, and we're going to make her one of the best doctors that a physical therapist has ever, a need of a physical therapist has ever needed. Wait, is that how you say it? It is what it is. Anyways, with that being said, thank you so very much for joining us this morning. And we want you guys to acknowledge that this is happening on a regular basis. So make sure to follow theprescotttimes.com for more information and more awesome people, because that's what we like to do around here. We'll see you guys later. Bye-bye.
Bye.